Spontaneous abortion or miscarriage is the unintended loss of a pregnancy before the 20th week of gestation. It is a common occurrence affecting about 10 to 20% of known pregnancy. As a future nurses, it is essential to understand the physiological, emotional, and psychological impacts of spontaneous abortion on patients. This knowledge will enable you to provide compassionate care, identify potential risk factors such as chromosomal abnormalities or maternal health issues, and offer appropriate support and resources to individuals experiencing challenging event. Your role in education, prevention, and management is vital in addressing this significant aspect of reproductive health. First, we'll see the definition of spontaneous abortion. Spontaneous abortion refers to pregnancy loss at less than 20 weeks gestation in the absence of elective medical or surgical measures to terminate the pregnancy. So here the spontaneous abortion, it's a loss of pregnancy. They are not having any medical or surgical measures here. The term miscarriage is synonymous and often is used with patient because the word abortion is associated with elective termination. So that's the simple definition of spontaneous abortion. Moving on to the next slide, that is etiology or the causes. So the etiology or the causes is a little lengthier one where you have to know what exactly the cause of spontaneous abortion is. So they have categorized under 4 headings. First one is ovo-fetal factors, second one is maternal environment, third one is paternal factor, and fourth one is unknown. We'll see the first one, that is the ovo-fetal factors, usually operates in fetal wastage. So the evidence of histological and cytogenic study of abortus reveals a gross defect in the ovum of the fetus. The defects being the chromosomal abnormalities, gross congenital malformation, blighted ovum, and hydropic degeneration of the villi. In early weeks, death or disease of the fetus often precedes the expulsion action of the uterus. Just to know what is blighted ovum. A blighted ovum or an embryonic pregnancy is when a fertilized egg implants in the uterine lining but does not grow into an embryo. The gestational sac and placenta will grow, but an embryo does not grow, so the gestational sac stays empty, and this is called as blighted ovum. To understand the word, that is hydropic degeneration of the villi. So hydropic degeneration of the villi is a form of hydropic degeneration of the placenta that can occur in the first trimester pregnancy loss. In this situation, the serum beta HCG will tend to be low and tend to show a decline with the repeat testing. The other cause here is in the ovo-fetal factors, interference with the circulation in the umbilical cord by knots, twists, or entanglements may cause death of the fetus and its expulsion. The third one is the low attachment of the placenta or faulty placental formation may interfere with placental circulation. The fourth one, twins or hydramnios by rapidly stretching the myometrium may also be the cause of abortion. So these are the various causes which comes under the ovo-fetal factors. Moving on to the next factor, that is maternal factors. Maternal factors usually operates in the late abortions, leading sometimes to expulsion of a living fetus, but they're too small to survive in the external world. So under this you have various factors listed down. First one is maternal illness. So under maternal illness you have infection, maternal hypoxia and shock, chronic illness, and endocrine factors. The The second one being a trauma, third one toxic agents, fourth one cervicouterine factors, fifth one immunological, sixth one blood group incompatibility, seventh one premature rupture of membrane, and the eighth one is dietetic factors. So the first one, as I've said you, is maternal illness. Under that, the infection. Viral infections, especially rubella and cytomegalic inclusion diseases, produce congenital malformation and abortion if it has been contracted in early weeks of pregnancy. Second one, the viruses of hepatitis, parvovirus, influenza have got lethal action on the fetus, causing its death and expulsion. The third one, parasitic, malaria and protozoal infection, that is toxoplasmosis, may produce abortion if contracted in early pregnancy. The fourth one, hyperpyrexia, may precipitate abortion by increasing uterine ability. So under maternal illness, first one we have seen about the infection. The second one is maternal hypoxia and shock. Acute or chronic respiratory disease, heart failure, severe anemia or anesthetic complication may produce anoxic state which may precipitate abortion. The next one, severe gastroenteritis or cholera, which is prevalent in the tropic, is also the important cause. Next one being the chronic illness like hypertension, chronic nephritis are responsible for late abortion by producing placental infarction resulting in fetal anoxia. Last one in this is endocrine factors. An increased association of abortion is found in condition of hypothyroidism, hyperthyroidism and diabetic mellitus. So these are the various points which comes under the maternal illness. That is, the first one we saw was infection. The second one is maternal hypoxia and shock. The third one, the chronic illness, and the fourth one is endocrine factors. The second one being a trauma. Direct trauma on the abdominal wall by blow or fall may be related to abortion. But fortunately, except in abortion prone women, the pregnancy remain undisturbed. That is the fortunate one. Second one is psychic. Emotional upset or change in environment may lead to abortion by affecting the uterine activity. In susceptible individual, even a minor trauma in the form of journey along a rough road, internal examination which we do in the early months, or eliciting the Haga signs or sexual intercourse in early months is enough to excite abortion. The other cause is amniocentesis. The chronic villus sampling or abdominal surgery in early months may cause abortion. The third cause is toxic agent. Environmental toxins like lead, arsenic, anesthetic gases, tobacco, caffeine, alcohol, radiation in excess amount increases the risk of abortion. Also, the drugs used for epilepsy or antimalarial preparation like quinine are not so much harmful when used in therapeutic doses. So, it says that you can use these drugs as in a therapeutic use which is not as harmful. So there are various list of drugs which is harmful for the fetus during the time of pregnancy, which also has to be considered. The fourth one being a cervicouterine factors. These are mostly related to the second trimester abortion. Like cervical incompetence, either congenital or acquired, is one of the commonest cause of mid-trimester and recurrent abortion. Congenital malformation of the uterus in the form of bicornuate or septate uterus. Uterine tumors, that is fibroid, especially of the submucous variety, is responsible not only for infertility but also for abortion. So you can see in the image the abnormalities of the uterus like bicornuate uterus, septate uterus, and also you can see if there is a cervical incompetency. Also, these are certain reasons which will lead for spontaneous abortion. The next reason may be a retroverted uterus. In the image you can see how the normal uterus, the position is, and how the retroverted looks like. So here the retroverted uterus is not responsible for abortion, but it may also become responsible when its association might be due to its failure to rectify between 12 to 14 weeks due to the adhesions or due to trauma during a sexual intercourse, or it could be due to the disturbance in the uterine vascularity. Then it also can become a cause for the spontaneous abortion. The next one being a immunological. The presence of autoimmune disorders like lupus anticoagulant and antiphospholipid antibodies increases the risk of abortion. Let's see what is this lupus anticoagulants. The lupus anticoagulants are a heterogeneous class of immunoglobulins that specifically target the epitopes of the negatively charged phospholipid binding protein of cell membrane. When you have this condition, your body immune system makes abnormal proteins that attack the blood cells and lining of blood vessels. The presence of these antibodies can cause problem with blood flow and lead to a dangerous clot in the blood vessels throughout the body. The sixth one being a blood group incompatibility. Incompatible ABO group mating may be responsible. Rh incompatibility is the rare cause of death of fetus. But it is said that the couple with group A husband and a group O wife has got a higher incidence of abortion. The other cause being a premature rupture of membranes inevitably leads to abortion. So the membranes are ruptured prematurely, of course it leads to abortion. The eighth one being a dietetic factors. It is said that the deficiency of folic acids or vitamin E is often held responsible for spontaneous abortion. So we have finished with the maternal factors. Moving on to the paternal factors. Under paternal factors, that is defective sperm. Defective sperm contributing to half the number of the chromosomes to the ovum may result in abortion, but it is difficult to prove. However, it has seen that some women who abort habitually may have a normal pregnancy following marriage with a different man. The last one is unknown, that is 25%. In spite of these numerous factors which we have dealt now, or numerous factor which has been mentioned, it is indeed difficult in majority to pinpoint the cause of abortion in a clinical practice. So it remains unknown what is the real cause of spontaneous abortion in some of the cases. So we have seen about the etiology. Moving on to the next slide, that is the mechanism of abortion. In early weeks, death of the ovum occurs first, followed by its expulsion. But in the later weeks, the maternal environmental factors are involved, leading to the expulsion of the fetus, which may have a signs of life, but it is too small to survive. So it's been divided as before 8 weeks, 8 to 14 weeks, and beyond 14th week. So before 8 weeks, what happens? So before 8 weeks, the ovum surrounded by the villi with the decidual covering is expelled out intact. Sometimes the external os fails to dilate. You have an external os and an internal os, right, in the cervix. So the external os fails to dilate and the entire mass is accommodated in the dilated cervical canal, and it is called as cervical abortion. So the whole content that comes and gets accommodated in the cervical canal, and we call it as cervical abortion. In 8 to 14 weeks, the expulsion of the fetus commonly occurs, leaving behind the placenta and the membranes. A part of it may be partially separated with brisk hemorrhage and remains totally attached to the uterine wall. So you can see there is an expulsion of the fetus, but sometimes the placenta may be remaining and its membrane may be remaining inside the uterus. So there is partially separated, and you can see there is a brisk hemorrhage, or it may remain totally attached to the uterus, which we call it as adherent placenta. So we have also dealt with the placenta, that is placenta accreta, increta and percreta. So in such cases, when there is an adherent placenta, so we have to go for a further management. So beyond 14th week, the process of expulsion is like that of mini labor. The fetus is expelled first, followed by the expulsion of the placenta after a varying interval. So it is similarly how we have seen the normal labor. Similarly, it's called as a mini labor. The fetus is expelled and it is followed by the expulsion of the placenta. So that's happened beyond the 14th week. In conclusion, understanding spontaneous abortion is essential for nursing professionals as it encompasses both medical and emotional care aspects. Nurses play a pivotal role in identifying the risk factors, providing compassionate support, and managing the physical and psychological impacts on patient. By staying informed about the causes, prevention, and treatment options, nurses can offer comprehensive care that address the multifaceted needs of individual experiencing a miscarriage. Their expertise and empathy are crucial in helping the patients navigate this difficult experience and promoting overall reproductive health. I hope that today's class is informative for you. If you have any questions based on this, you can just put it in a comment section. Thank you.